The Heroes of Infection Prevention Award honors infection preventionists who have successfully reduced infection, raised awareness, and improved the health and well-being of patients, healthcare workers, and the public. Supported by a grant from BD, an APIC strategic partner, the program has recognized more than 100 individuals and groups for their exceptional work in reducing healthcare-associated infections. It is an honor to recognize the following as 2018 Heroes of Infection Prevention. By fully leveraging expertise from multiple departments, the infection prevention team at Excela Health effectively tackled rising Clostridium difficile rates at their 3-hospital system. Team leads Joanne Grote and Deborah Schotting came to infection prevention from different professional backgrounds, so they understood the benefits of varied professional perspectives and experience.
Their CDI lean team was really focused on Clostridium difficile infections and the identification and the prevention of those. And so what they were able to do through patient education and physician education, through their antibiotic stewardship program, and a variety of other comprehensive strategies, they were able to achieve long-standing reductions in their rate. And they did that through system-level improvement.
They leveraged everyone's strengths, and in just 2 years, the system achieved a 43.8% reduction in healthcare-associated C. diff infections. Dr. Cindy Ho has systematically created and sustained programs that reduced rates of HAIs while improving collaboration around patient safety at her hospital system. Named Physician Chair of Infection Control for Jefferson Health, New Jersey in 2012, Ho quickly determined that she wanted to expand beyond the Infection Control Committee to reduce HAIs. She established a task force to address rising Clostridium difficile rates that same year and followed annually with new task forces addressing other infections.
Ho really had an intriguing approach. She engaged administrative leaders, and she also was able to engage staff. So there was an environment of mutual respect and leadership engagement too, which I think really drove sustainable and reformative results.
The approach has generated impressive results, with decreases in CLABSI, CAUTI, C. diff, and sepsis-associated mortality. The Infection Prevention and Quality Departments at Mountain View Hospital combined evidence-based process improvements with an emphasis on frontline collaboration to significantly enhance safety for their patients. In early 2015, the team leveraged their varied medical technology, quality, and nursing backgrounds to create processes to reduce healthcare-acquired conditions across the board, with an emphasis on C. diff. They developed an algorithm to prevent unnecessary C. diff testing and focused on antibiotic de-escalation, proper environmental cleaning, and empowering many infection preventionists on every unit.
The infection preventionists drove a culture change at Mountain View with the tagline, "Proud of nothing," or that 0 infections was possible, and they significantly reduced their C. difficile infection rates.
Children's Hospitals and Clinics of Minnesota team. The Infection Prevention and Control team at Children's Hospital and Clinics of Minnesota effectively employed their experience and relationships to rapidly contain the largest state measles outbreak in 30 years. When Children's identified the first case in April 2017, established IPC processes and systems gave the team a head start on containment. These included an empty and ready spreadsheet to track individual patient details, an electronic medical record that generated reports detailing potential in-hospital exposures, and the knowledge that children's staff was MMR vaccinated.
The infection preventionists at the Children's of Minnesota reduced the transmission of measles within 5 months, and they coordinated a statewide effort among all the infection preventionists.
Having strong cross-hospital relationships enabled the team to mobilize people quickly.
Marc Meyer was able to leverage both his pharmacy and his infection prevention expertise to develop an antimicrobial stewardship program in his small critical access hospital. When he did that, it was able to gain attention both at a local and a national level. And I think it really solidified his role as an ambassador for appropriate antibiotic use.
A pharmacist by training, Meyer assumed responsibility for his 25-bed hospital's infection control department in 1995. He quickly recognized the importance of using data to mobilize IPC improvements. Southwest Memorial credits Meyer and his department for a 60% decline in surgical site infections and a 30% decline in multidrug-resistant organisms. But Meyer knew that hospital-based efforts alone would not preserve antimicrobial efficacy. He works on antimicrobial stewardship initiatives at the state level with the Colorado Hospital Association and nationally with the CDC. The Infection Prevention and Control Team at University of Louisville Hospital developed a program emphasizing continual education, awareness, collaboration, and fun to reduce catheter-associated urinary tract infections at their facility. The program includes an annual CAUTI-free April, a month-long campaign during which the team intensifies their focus on CAUTI education. Featuring a Make Voiding Great Again theme, the 2017 campaign involved around-the-clock rounding on all hospital units, CAUTI reduction competitions, and prize drawings recognizing best CAUTI reduction practices. Throughout the campaign, the team emphasized collaboration and relationship building across departments.
The creativity of the University of Louisville's infection preventionists and belief that education is fun helped reduce their catheter-associated urinary tract infections by a third.
We salute our Heroes recipients and we thank them for their innovative patient safety work.